Hi everyone, good morning. My name is Marianne. I'm currently working on my associates in general studies here at Valencia. I already have an associate's degree from Everest University, but given their involvement with Corinthian colleges and other fraudulent practices, I was able to get those loans forgiven, and now I feel like my degree doesn't hold any weight, even though I still have it. I wanted to have a degree from a reputable, recognizable college here in Florida, so I figured Valencia, just completing that, those credit courses here at Valencia was the best step. I would like to pursue a career as a pharmacist. I do currently work in a pharmacy, but I work in a support role. It is very rewarding. I do still speak with patients and I help patients every day, but I think pharmacist is ultimately like the pinnacle of where I'm trying to reach. One of my strengths is I'm very good at helping others. I have dedicated the last 12 years of working in a pharmacy. I strive to ensure that all of my patients get their medications and their medications are affordable, whether they're Medicare or commercial. And I think one of my greatest achievements is landing one of the biggest accounts at my pharmacy. I am currently a senior account manager for my pharmacy. I work for Elevance Health, and I've been with the company for over 6 years. I plan on giving them at least 10 to 15 years, given that, of course, nothing changes with my current role, but in the interim, I would like to at least work on having that degree, hopefully from UF. My plan is to hopefully join the UF School of Pharmacy, so I can get that degree and then move up to become a pharmacist. And at that point, I can now better educate the patients on the medications and their costs, because I feel like doctors are very quick to prescribe medications, but they don't really explain to the patients what kind of side effects they might experience or what comes with taking the medications. And I feel like that's equally as important as knowing what it's going to cost you. It can cost you a lot of money, but it can also cost you your life. And I feel like that's just not discussed enough. I hope to learn from this course. I do a lot of onboardings with locations. So I work directly with providers and I provide them, I kind of just talk about our services and what we can do for their offices just to help expedite those patients' prescriptions, so the providers can go back to just focusing on patient care, and we'll take care of all the paperwork, all the authorizations and the appeals and that kind of stuff. I find myself kind of ranting a lot during my conversations with the providers. Not necessarily bad rants, just kind of how I'm doing now, where I just start talking in circles rather than getting to the point. So I'm hoping that just with the course, I can just sharpen those skills a little bit, maybe work on my vernacular, and hopefully better articulate the things that I want to say to these providers, as well as for the patients, since I'm going to be speaking to them about clinical data and package inserts and side effects and stuff. I want to make sure that I'm explaining it to them in a way that they can understand it, and if they have any questions, I can educate them so that way they know what to ask their providers in case they have any questions about their medications. So a bit loaded here.